Okay, good night. Yours truly, Dolphy Gilpin, in continuation with CME, Continuing Medical Engineering Education, or Continuing Medical Education. And tonight I'm at 1524 LaVista Drive, Decatur, Georgia, United States of America. I'm on the second floor with the endocrine system being chosen tonight from my random topics in medicine. And in particular, from this endocrine system, the malignancy of hypercalcemia has been chosen. And previously we described hypercalcemia now as abnormal amount of calcium in the blood, an elevated or abnormal amount of calcium in the blood. And this increase in calcium in the blood can cause bone pain, it can cause kidney stone, it can cause heart problem, as well as a brain problem in the depression, arrhythmias, fainting, and other vital sign malignancies. That was described previously. So this is just a brief review, and that an overactive parathyroid glands can cause this hypercalcemia. And here we have 4 parathyroid glands, 2 upper and 2 lower parathyroid glands in this simple anatomy. And an invasive procedure of a nephroscope was introduced into the kidney to detect this renal pelvic stone. And this was a posterior view with the nephroscope inserted to detect the kidney stone. Now let's get more in depth into the type and causes of hypercalcemia. Now 90% of all causes of hypercalcemia in the outpatient setting are caused by primary HPT. And this abbreviation HPT stands for now hyperparathyroidism, or now hypercalcemia of malignancy. The causes of hypercalcemia: we have primary hyperparathyroidism, which cannot be sporadic or familial. Secondly, now hypercalcemia of malignancy. And integral in this is the Austenitic Hypercalcemia. And as you know, osteolytic has to do with the bone. Therefore, there can be abnormal amount of calcium in the bone. And that's called osteolytic hypercalcemia. Humoral hypercalcemia of malignancy. Ectopic production of calcium by a lymphoma. And ectopic production of parathyroid hormone. Now, hypercalcemia of granulomatous disease with chronic renal failure and with aplastic bone disease. In continuation, we have tertiary hyperparathyroidism and acute renal failure. Familial hypocalcemia with lithium-associated hypercalcemia. And finally, we have no vitamin D intoxication and other real causes as increase in calcium intake, pheochromocytoma, congenital lactose deficiency, hyperthyroidism, vitamin A intoxication, thiazides, milk alkalization, immobilization, and theophylline. So those are types and causes of hypercalcemia. Now, symptoms of hypercalcemia. We have symptoms in the bone and muscles, and in most cases, the excess calcium in the blood was leached from your bones, which weaken them, and this can cause bone pain, muscle weakness, and depression. Symptoms in the brain now. Brain hypercalcemia. Hypercalcemia can interfere with the way your brain works, resulting in confusion, lethargy, fatigue, and depression. Symptoms of the heart. Now, really severe hypercalcemia can interfere with the heart function, causing palpitations, fainting, indications of cardiac arrhythmia, and other heart problems. Now, the symptoms of extreme thirsts. Extreme thirst, urinary frequency, and abdominal pain are all indicative now of hypercalcemia and necessitate now one seeing a doctor if these symptoms are manifested. That is extreme thirst, urinary frequency, and abdominal pain. You should seek a doctor with such symptoms. Now, diagnosis. Hypercalcemia can be asymptomatic or can cause few, if not any, signs or symptoms. Now, routine blood tests can reveal a high level of blood calcium, and blood tests can also reveal whether your parathyroid hormone level is high, which is indicative now of hyperparathyroidism. Now, to determine if your hypercalcemia is caused by an underlying problem such as cancer or sarcoidosis, imaging tests of your lungs and heart is necessary. So let's briefly go through these hypercalcemia. We said now that hypercalcemia once again was elevation now of calcium in the blood. And mathematically, we could say now that 4.3 to 5.2 milliequivalent per liter of calcium in the blood, with levels greater than 2.6 millimolecules per liter. This will define hypercalcemia. So that's a mathematical sort of measurement for hypercalcemia. 2.6 millimolecules per liter of calcium. Those symptoms are abdominal pain, bone pain, confusion, depression, weakness, complications, kidney stones, abnormal heart rhythm, cardiac arrest. No treatment, and we'll very briefly go through treatment because we're going to have to expand with an in-depth analysis of the chemical configuration and the IUPA and chemical name and generic names and so on and so forth. So treatment, and